First, Fritz Schumacher might have tried to convince us all that small is beautiful, but modern fashion and ideas of beauty would not agree. Nowadays, tall is beautiful, which is why increasingly for cosmetic purposes, people are undergoing this sort of surgery. Dr. Yasser Elbatrawy operates in Cairo to give the men and the women who come to see him from all over the world a few extra inches where it matters, on their legs. He's the world's leading limb lengthening specialist.
We can lengthen the leg or the thigh for cosmetic reason, and also we lengthen humeral, forearm, even foot. This procedure is called the bloodless procedure. We apply the frame externally. There is no big wound or incision. It's very, very small incision. I think you saw in the patient maybe 3 or 4 millimeter incision. And through this incision, we cut the bone in this special way, preserving the periosteum, which is the membrane around the bone, which carries the nerve supply and the blood supply to the bone.
This method, as are all current techniques, is based on the Lizarov technique, developed in Russia in 1951. After surgery, the fixator, the metal structure, holds the ends of the bisected bone rigid. Starting 1 week after the operation, the fixator, millimetre by millimetre, pulls the ends of the bones apart, and the bones grow to fill the gap. That's what's called distraction or lengthening. Overall, the patient is committed to 6 months to grow 5 centimetres. Mohideen Kebab has come from Massachusetts for his operation. He's in his early 20s, 5 feet and rising.
When you go into a job interview, they always pick out the taller people. And when you try to sell a product, I worked in as a sales rep. People are not buying the product, they're buying you. And when they look at you and you're short, they tend to not want to buy it from you. I mean, yesterday I was not even able to move, and I was asking for morphine every hour or so. But today it's a lot better. Even though it's only been 1 day, now I can move my toes, and I can sit up and everything.
Just one week after the operation, we start to distract in a rate about 3/4 to 1 millimeter per day, and then we start lengthening.
In another part of the hospital, a patient who wishes to remain anonymous is a month taller than Mohideen. He had travelled from Australia to augment his 5 feet 4.5 inches.
It's been exactly 1 month now since the operation. I was very relaxed before the surgery. I didn't know what I was going to get into. But I spoke to a lot of patients. They said, "Oh, the pain is intolerable. Only do this surgery if you really have an outgoing personality. It is going to be very, very painful." You can feel something going inside your bone. There is something inside your bone. But it's not like a sharp, intolerable pain. This pain is tolerable because it's everywhere. It's kind of a controlled kind of pain. Before the operation, I used to put socks inside my shoes to make myself taller. And I did this for 2 years, so I was in a lot of pain for 2 years. And at night I would take my shoes off and I would just feel a relief when I take my shoes off, because I would not take my shoes off